Welcome back. Thank you for staying with us. So in the first part of the podcast, we already discussed about what is hypertension, who are at risk to get hypertension, and how to measure blood pressure, right, Dr. Beh and Dr. Wong? So for the second part of our podcast today, we want to discuss about how to manage blood pressure. So Dr. Wong, if someone feel that they have high blood pressure, what's the next step that they should do?
Okay, thank you, Dr. Mikraz. Listeners, so welcome back. So basically, the first management for patient or person who have diagnosed with hypertension is to have a lifestyle modification or lifestyle change. It's not only cheap, but it's also very effective. So that's the first one. So what do you mean by lifestyle modification? I think earlier on, Dr. Beh shared the modifiable risk factors. So something that you can change, that is the one. So first, about diet. Yes, diet, we need to eat well. So basically, eat a balanced diet. Try to reduce sodium, which is the salt intake, to 1 teaspoon per day. 1 teaspoon per day. But of course, sometimes it's very hard to measure, you see. And then usually, generally, we give advice of cutting down processed food, salty food, okay, cutting down all the saucer, canned food, because if you compare, they have a lot of salt inside the food there. So try to go for original spices to replace for that. If you want the spices to have that, and not only that, we want to advise you to get more fresh fruits. Okay, try to get to reduce the oil, the saturated fat. Okay, and also try to get more fiber. I think in Malaysia we have this. I think most of us know here. I need to stress on again, which is the healthy plate. Okay, so healthy plate. What are the healthy plate Malaysia? So we have healthy plate in the plate. We half of it must be vegetable or fruits, and then quarter of it must be carbohydrate, and quarter of it must be the protein. And when you choose protein, you must choose the lean protein. That is the best.
Yeah.
And other than
what is lean protein?
Usually less fat.
Yeah.
Less fat. And also whole grains, and also sometimes food like high in potassium. Of course, whatever it is, I think you try to take in moderation in terms of diet. Okay, and what work best for you might not work best for others.
Yeah.
And for other than that, we also have weight management.
Okay.
I think very important. I think also Dr. Beh earlier, she has stressed on 1 kg reduction of your weight can reduce 1 millimeter mercury. Even though the number is small, but the clinical impact is big.
Yeah.
So
be patient, right?
Be patient. Yeah. And of course, we need to have more physical activity. Be active. Basically, I think we recommend moderate intensity like cycling, jogging of 150 minutes per week. Also, sometimes we want to have a more vigorous activity. Then you can around 75 minutes per week.
Okay, so lifestyle change is very important. Your diet. So if possible, try to limit ultra processed food. Okay, because they contain high in salt, right? So try to get whole food, high in vegetables, right, and fibers. Okay, exercise, lose weight. Right, Dr. Wong, anything else?
Yes. I think exercise also sometimes a lot of my clients, they say it's not easy. Yes, it's not easy. I can agree with you. But we have to try at some point of time. Do the exercises that you like most. Try with that. So sometimes we have hobbies. So these are the things that we can do.
Discipline is the key, right, Dr. Wong? Discipline and patience is the key.
So other than that, I think managing stress effectively is also very important. Have some coping skills to handle stress. You can actually have some relaxation therapy. No doubt, the study is not very in terms of evidence, it's not very high grade, but it's something that you can do to really better for the mental health. So this is something that we can do. We make sure that you have enough sleep. We need 7 hours of sleep per day.
So, I think it will be difficult for me to achieve.
So too less is not good. Too many hours of sleeping also not good, right? So 7 is the magic number, I would say. All right. Okay.
So if you are smoking, stop smoking.
Yeah.
Okay. If you don't smoke, please don't smoke.
Don't even start.
Don't even start. Okay. This applies to vaping as well. So because we know they have a lot of ill chemical dangerous chemical inside the nicotine, inside the smoke, so it can cause hardening of the blood vessel, causing the high blood pressure.
Okay, all right. And then we received like very interesting question from our audience, right, Dr. Wong? They mentioned about sometimes my blood pressure is normal if checked at home, but every time they come to the clinic, their blood pressure will go up. Okay, so with this type of patient, is there something to worry about, Dr. Wong?
Okay, so to answer that, first we have to understand this term, what we call a white coat hypertension. So this is something that it does happen to our patient who come to see us. Sometimes we jokingly say because the doctor is very handsome, or the nurse or doctor is very beautiful, that's why the blood pressure is up.
They are looking for parking, stress in looking for parking.
Yes, that's also possible.
And traffic jams.
That's possible. Yes.
Yeah.
Not long waiting hours, eh?
Okay, so this is some incidences that where blood pressure increases, especially if measured outside from the home, or perhaps I think in our setting is a clinic. So the white coat is basically, I think, is termed as such because last time it used to be the doctor who wear the white coat and measure the blood pressure. That's why it's called white coat blood pressure, white coat hypertension.
Okay.
So regarding whether is it something
Will you say it's hypertension?
Okay, so no, we will not label that as a hypertension yet, but what we normally do is we will order ambulatory blood pressure monitoring. This ambulatory blood pressure monitoring is actually to have a device to measure the blood pressure of the patient in 24 hours. So it can be, they will take at a regular interval of blood pressure. You have to just connect and then they will just auto. Maybe you will measure when you're doing activity, when you're sleeping, and it's actually for 24 hours. Okay. So then we can see the pattern of the blood pressure. Okay. So that is the most accurate way to see whether this patient had white coat or not. Okay. And regarding whether it's sinister or not, I think if let's say the blood pressure normalize that after at home, then usually it will not be quite a concern. But if let's say it continues to be high, very high, then it's something that you will need to, the doctor will discuss further with you whether to start treatment or not.
Okay, so if you're not sure, please go and see your doctor for confirmation, right, Dr. Wong? And if you're worried, because people with high coat hypertension, they are also at risk to get hypertension, so we have to start on lifestyle intervention first, right?
Definitely.
Yeah, I think just now Dr. Wong has clearly tell us what are the lifestyle intervention that we can do. So, Dr. Beh, do we need to take medication then?
Okay. Yeah. So I think Dr. Wong have already explained very in detail on lifestyle changes as well and modification, which I also agree that we actually should advise our patient, which is at the first line of the treatment for patient with hypertension. So I think, of course, sometimes with the blood pressure reading is like above 140/90, as we mentioned earlier. And then patients' home blood pressure is always normal. And then Dr. Wong also have mentioned to go for ambulatory blood pressure monitoring. So with that, if let's say the ambulatory blood pressure monitoring have confirmed that this patient has high blood pressure, and I think that we should start the patient on medications. Where the one that the commonest patient will ask it, so do I need to take lifelong this medication?
Yes.
So back in the first discussion that we had was like, blood pressure, because if the blood vessels, the saluran darah, the blood vessels is actually hardening and then causing the blood pressure. That's why I think it's considered as a chronic diseases. That's why we need to start on medication to control the blood pressure. If we did not start on medication, it's only rely on lifestyle alone, sometimes it might not be adequate to actually control the blood pressure. That's why with the help with the medication, plus with the lifestyle changes, then the blood pressure can be controlled. Yeah.
Okay, so after lifestyle intervention, if it's still not controlled, then you may need to start on medication. Right, just now Dr. Beh have mentioned about salt, and now we are getting another interesting question that said, okay, besides salt, what about red meat, Dr. Beh?
Yeah, that's actually quite a common question as well, being asked by patients.
Yeah, because just now Dr. Wong mentioned it about lean protein. Right?
So red meat is actually considered the food that can actually increase in cholesterol, basically. Yeah. So we know that like cholesterol, high blood pressure, diabetes, they are like siblings. right? So they comes usually very commonly comes together. So patient might have having these three diseases or condition together. So if let's say we did not control like cholesterol itself, and then it also might contribute to other, what we are more worried would be the complication of blood pressure. So let's say they do have like cholesterol plus with high blood pressure plus diabetes, they actually increase their risk of getting heart attack, stroke, kidney problems. So if let's say you're getting a lot of like red meat, it will also contribute to high cholesterol, which will contribute to the complication of the heart disease and
so
all
they are
that.
like interrelated.
Yeah, they are called sort of like interrelation. But of course, sometimes we also have to look at how does the preparation of the red meat as well. Whether you are putting a lot of salt, putting a lot of soy sauce, ketchup,
Now
and
you
all
know
that.
like they have the salt bay, something
Yeah.
like
So that can also increase the risk of getting blood pressure uncontrolled as well. So if let's say you're getting the red meat but with the high salt content, then definitely it can increase the blood pressure. Yeah. So maybe we can add on another advice for patient will be, if you go to supermarket, you can see some product they actually having label as a low salt kan, macam low sodium, low salt product. You can actually choose this kind of sauces or this kind of products. And also you can actually read the labeling as well. So the labeling of the sodium content, usually we advise less than 5% of daily value. Then you can choose this kind of products.
Okay.
Yeah.
All right. So I would say that what can guide you is that look at the label. Try to choose something with less salt, and then or if you want to know, there's this healthier choice logo. So if you find any food product with healthier choice logo, please go for that one. So for Dr. Wong, as someone who sees a lot of hypertension case, can you help our audience to understand what are the possible complications if someone diagnosed with hypertension didn't get it treated or not manage it correctly?
Thank you so much, Dr. Mikraz. Definitely, hypertension is a very important disease, and we all know in Malaysia, cardiovascular disease is one of the highest, the number one killer for Malaysians, and in fact in the world. And of course, why I say it, because hypertension can cause a problem. Hypertension is unmanaged, can actually damage the heart of the muscle, and also can harden the blood vessels. So indirectly can cause further damage to the heart. So the patient may have risk, as I mentioned earlier, coupled with the high cholesterol, can get heart attack, and also can get what we call the heart failure. Because I think we all know the heart is a pump. So imagine a pump in which there's a high pressure. They need to pump, they need to work harder. So not any good pump or engine, when you overuse, definitely it will come faulty at some point of time. So that is when the time the heart cannot function at maximum capacity because of the pressure, the high pressure that they have. So this patient may have a heart failure.
So in general, what's the target blood pressure reading so that we don't exhaust our heart?
Remember the diagnosis is not more than 140 or 90 or equivalent, but definitely we need to get less than that. So in certain patients who have other diseases such as kidney disease, then we go even lower, 180 or 80. So it depends on patient to patient, but generally it's less than 140 or 90. Okay? So of course we want to the lower, that is okay, as long as it doesn't cause any symptoms for the patient.
Okay.
And other than the heart, we also have don't forget the brain. So brain, yes, pressure. Imagine the blood vessel, the holes just now mentioned. So imagine the pressure is too high, it can burst. So that is what we call when the blood vessel in the brain is very small, very tiny. Imagine high pressure, it can actually burst. It can cause what we call a stroke.
Stroke, okay. But stroke have two types, right? The one, it can either the bleeding type or the clot.
So hypertension also can lead from both.
Okay, all right, okay. So just now you mentioned that if you don't get it treated or you don't get it controlled, so you are at risk to get a heart attack and stroke. So what about diabetes, Dr. Wong? Because during the break, I went through the question from the audience. And then there is this one interesting question from the audience that they need some, can you shed some light about these two conditions, diabetes and hypertension? Is it true that most patients with diabetes, sooner or later, they will get hypertension?
That is a very interesting question. Thanks to the listener. Before I go on for that, I just want to add on one or two more complications so that we are more aware of the complication. And the other one would be height. Sometimes, again, the eye also got vessel, got blur. Hypertension can cause vision loss, and the worst stage even blind. And we also have complications in terms of the kidney. Yes, kidney also can damage the kidney because kidney has to work harder like the heart to pump up the water, extra water or extra to remove the pressure. And just going back to our first podcast, on men's health, which hypertension is also one of the risk factor for erectile dysfunction. That's for men, but for women, in terms of sexual arousal problem, also it also can cause.
So they get less interest. Okay.
And back to the diabetes related, yes, they are interrelated. So say they are abang adik. In Malay, they are
siblings.
So in Malay, they will say that tiga serangkai.
Okay, we have high blood pressure, diabetes, and high cholesterol. So of course, in terms of the high blood pressure or hypertension, usually can be found at 2 out of 3 of diabetes, they have high blood pressure. And then what more scary is the interrelation if they are a bad combo, a bad combination, in which it can cause further risk of complication to the cardiovascular disease.
So I think that diabetes can lead to hypertension because with diabetes it can cause the narrowing.
Even the insulin resistance also can cause vice versa.
So to simplify it, actually, anywhere where the blood supplies the body, when you have hypertension, it can cause complications too. I think from brain to your heart, to eyes, to your kidney, and to your legs, right, Dr. Wong? So thank you so much for the explanation. So now for Dr. Beh, we've seen that nowadays that the young generation are getting more active with exercise. So that's a good sign, right? So, but okay. We also receive comment from our patients that they are quite concerned, like when after they do perform any exercise, when they check their blood pressure and their blood pressure goes up. Okay, is it something that we should concern of, Dr. Beh?
So I think that's a very interesting question. I think for young adults, I think Dr. Mikraz have actually also mentioned that nowadays our prevalence of blood pressure and also those unaware of their having high blood pressure are actually getting more and more, higher in prevalence. So that actually also bring us to actually need to understand that if let's say the patient having a high blood pressure at such a young age, we should actually go for a further workup, like investigation, to actually find out why is this patient having high blood pressure at such a young age. So I just had the patient 2 weeks ago that she had a blood pressure, hypertension since she's 20 years old, but now she's 40 years old. So it's actually 20 years back that she had high blood pressure. So I was thinking, shall I still check for and investigate for other causes of hypertension for her? Like such as like the one I mentioned, like some endocrinology kind of medical illnesses, like hormone related kind of diseases. So I think that we should because this patient had it since 20 years ago, when she was 20 years old. So true enough, after I've investigated, then she was actually having Cushing's syndrome, which is one of the conditions that the hormone, there's an extra hormone in the body that increase the blood pressure. So it was actually very surprised that she had it for 20 years, seeing a doctor, but without being investigated and being treated properly. So that's why I think to all of us out there and to friends and all that, our families and all, should always notice this condition and should actually check early. Just check as early as 18 years old also it should be advisable. And then come back to your question on the exercise. Actually good that young people like me also that likes exercise. So actually that if you started to exercise, that our blood pressure actually will rise. This is true because you are like running, jogging and all that, your heart rate will go up and then your blood pressure will go up. So it will actually go up at about 10 to 15 minutes actually from the starting of the exercise. But that sometimes there's some study actually show that from that one that actually can causes patient to suddenly have heart attack and whatnot. But the condition that we advocating is, of course, we don't really say that, oh, then you stop exercise. No, we don't really do that. So what we actually advising patient is you should go slow and start slow. So means that you can do whatever that you can afford first. Then once that you have been like suitable for your heart rate and your condition, then you started to add more, like then more hours from the normal walking, then after that to jogging slowly, increase the intensity throughout the time. So that would be more advisable because also there are a lot of studies also show that if you exercise more, you can actually reduce a baseline risk of having a heart attack, reduce a baseline risk of having hypertension, as well as other, like Dr. Wong had mentioned just now, all those complications.
So basically, I think exercise has more benefit compared to serious.
Yes.
And the increment is just temporary, right?
Yes, it was just temporarily for about
Yeah.
10 to 15 minutes, and then after that it will go down slowly and maintain it.
Maybe I would like to add on. Okay, maybe that one suitable for someone who has not been diagnosed with hypertension. But if you have other diseases like diabetes or you already have a heart attack, so it's good to get clearance for your doctors. Right, so maybe we need to change in terms of the intensity, and so that you can exercise safely. Right, that's very important. Okay, I think Dr. Beh and Dr. Wong, we have got a very fantastic discussion today. So, but thank you so much for your insights. I hope that all the audience have learned a lot from our discussion today. But before we wrap up, I'd love to have some final words from both of you. So maybe a quick takeaway or something that our audience can remember about how to manage or prevent from getting hypertension. So maybe would you like to go first, Dr. Beh?
Yeah, ladies first. Okay, so I think again we advising like prevention is better than cure. So I was advocating more on the what we eat as well. So if so I will actually advising more on like a pinch a day keep disease away. So meaning that a pinch of the salt a day, just very little of the salt intake, then you can keep disease away. So in translated in Malay, then will be garam cukup sedikit, cegah penyakit.
Nice one. Okay, thank you so much, Dr. B. Okay, any final word from you, Dr. Wong?
Okay, I think it's never too late to change, to start a healthy life. And we are always there. The family doctors, family medicine specialists are always there to help you. So don't hesitate to come to us. Get your blood pressure measured.
Okay, thank you so much, Dr. Wong and Dr. Beh, for joining us for this special podcast. To our audience today, thank you for joining us. Before I conclude, I would say that hypertension is preventable, manageable, and treatable. So please take control of your own health, right? So please know your number, okay, measure your blood pressure, and make a healthy choice, right? If you have any concerns about your blood pressure, please go to the nearest clinic or seek advice from your personal doctor. All right, and with that, we have come to the end of our special podcast in conjunction with the World Hypertension Day and Salt Awareness Week. So a heartfelt thank you to our amazing panelists, Dr. Wong Ping Foo and Dr. Beh. Thank you for tuning in and engaging with us, and thank you for all the fantastic questions. So if you found today's session is helpful, so don't forget to share it with your friends and family, because knowledge is meant to be shared. All right. So until next time, stay informed, stay healthy, and take care. Thank you again.